We are back with today's checklist, all about headaches, from the different types to the treatments and the symptoms that we shouldn't ignore. So joining us now is Dr. Vin Gupta, pulmonologist and NBC News medical contributor. Good morning to you.
Good morning. Dr. Beer.
Let's start with just the different kind of headaches.
Absolutely. So there's primary headaches that are actually just what is actually causing you to feel unwell. And then there's other causes like sinusitis, other maybe infectious causes that might be causing a headache. But these primary headaches here, what are we seeing? You actually see, we're trying to visually demonstrate it to you. So that tension headache.
That makes sense, that drawing.
Oh, that makes sense. We've all been there to some degree. Or maybe you have a loved one that's been there. It's like a band that's tightening around your head. That's that tension headache. It's the most common headache across the country, often undiagnosed. Migraine headache. It's on one side, really very undiagnosed, especially amongst women. But it's one side, often associated with things like light sensitivity, auras, you see things. And then there's cluster headaches, where it's also one-sided, not like that band that's squeezing on your head, and often associated, interestingly enough, with tearing. So you actually feel like you have eye symptoms as well.
Interesting. So what are some of the triggers we should be aware of for the primary headache?
Yeah, often it's changes in something, changes in your daily routines, but really it's stress. So often people don't realize that stress can tighten up the shoulder muscles. You can feel tight, and that actually pulls on the muscles around your head.
Okay.
And that triggers it. And so that's the biggest trigger. But changes in sleep. If you're not getting 7 to 9 hours, I know that's aspirational for many of us, but if you're predisposed to headaches, that can cause it. Changes in your diet. It's been hot here in New York City. If you're not hydrated, that can be a big cause. But something we don't talk enough about is there's a big genetic component, especially for migraine headache. If you have a family history of migraine, that is going to pass on and just going to put you at increased risk.
Okay.
So what medications should folks have in their homes to treat headaches? And perhaps what are some things that they should talk to their doctor about in terms of treatments?
Sure. If you're watching this and you've been there, blinds are drawn, you need darkness, you don't want any sound, you just want peace and quiet. What's the first thing you reach for? Probably going to reach for something like Tylenol or Advil. And so that's the common stuff. And
those are fine.
That's fine across the board, across all those various forms of headaches. What we've seen, though, is antidepressants actually can help regulate chemicals in our brain and can actually be helpful in the setting of tension headache and even migraines. Botox, if you have migraines. Many migraines, say 15 in a month or more, Botox has been shown to actually be helpful. You know what was interestingly enough? People found that when they were getting Botox treatments for their wrinkles, their headaches actually got better. And that's how we first realized, well, gosh, here, maybe we're onto something.
That's interesting.
That's interesting.
But then step-up therapy, there's things like triptans, especially if you have migraines, it can help actually end the migraine headache. And then for everybody out there, critical to know, there's a new generation of medications here, just in the last few years, that are frankly, much better than our traditional treatments. So have a conversation with your doctor, a lot of new medications.
I think it's important not to just suffer with it. A lot of people just deal with it year after year, and you don't have to do that. Finally, are there some things you can try that don't involve medication?
Chanel, I'd like everybody to take a headache diary because we need to know your symptom profile. There's something called the PIN technique. P for photophobia. Do you have light sensitivity? I for incapacity. Are you just that person that needs to lie down, can't do anything? Migraines can be debilitating. Is that you? And then do you have nausea? Do you have GI upset? If you have 2 of those 3 symptoms, you might have a migraine. So important to keep that headache diary, track your symptoms. Optimizing your diet, like we talked about, sleep. Cold, dark room, cold compresses, and things like acupuncture have actually been shown to be really effective in reducing the risk of migraines.
And just real quickly, do you ever need to go to the emergency room for a headache?
You do. So if over 50, if you've never had a headache before and you're over 50, that's a cause for potential concern, something to talk about with your primary care doctor. If you've had a thunderclap headache, worst headache of life, sudden onset, probably need to call the emergency room. And if you've ever had a fever and you have a stiff neck, also something to seek immediate medical attention.
Dr. Gupta, thank you.
So helpful. Thank you.
Thank you.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.